This is the questions in 2001 exam from question number 26 in the MCQ paper. So this is, I think this will be the last part of it of the paper. So we'll go to the questions. True or false about oral rehydration salts. Now, oral rehydration salts they are given for patients with dehydration, especially children and babies. You have to remember this formula. So the question is, it has glucose to increase the absorption of sodium from the bowel. That is true. Sodium, for absorption of sodium ions, glucose should be there. So glucose increase the rate of absorption of sodium ions from the bowel. The formula contains sodium chloride 3.5, potassium chloride 1.5, trisodium citrate, dihydrate 2.9, and glucose, anhydrous glucose 20 grams. This is per liter. You can prepare 1 liter with this. So this is these quantities. New formula is little different. This has a low osmotic pressure. So it has sodium chloride 2.6 and glucose and nitrous. Potassium chloride is the same amount in both old and new formulas. Trisodium citrate little different. So this is the formula. This also you have to remember. So now under these topics we will just see what are the contraindications and adverse effects. So when you keep on giving to a patient, if the eyelids are puffy, become enlarged, then that means the sign to stop ORS. Then give a little plain water for some time and then you can continue with it. If the patient vomits, you have to stop for 10 minutes and give ORS slowly. No contraindication for pregnant people and breastfeeding also no contraindication. Part B, once reconstituted, the solution is recommended to be used for over 2 days if it is kept at the fridge. That is false. You don't need to keep in the fridge. You can keep in a cold place, but you can keep maximum for 24 hours only. Discard the rest of the solution after 24 hours. C, it should not be given to babies who are on breast milk. That is false. It contains 3.5 grams of potassium chloride per liter. That is false. It contains 1.5 potassium chloride. 1.5 grams of potassium chloride per liter. 3.5 was the sodium chloride amount in the earlier formula. E, it corrects the water and electrolyte loss following diarrhea. It is true. That is why it is given when somebody has diarrhea. the potassium and sodium goes out, even chloride. So this is replacement of those ions with ORS. Question number 2, true or false regarding vitamins. Cod liver oil contains vitamin A and D. That is true. Normally we call it A and D capsules. So see the benefits. It is given for irregular heartbeat. It reduces irregular heartbeat. Not as the sole treatment. For irregular heartbeat, there are permanent treatments, but this reduces irregular heartbeat. Vitamin A is also called transretinol. That is one of the questions in the exam. Thiamine is vitamin B1. Vitamin B complex has several vitamins. So thiamine is vitamin B1. It is true. All vitamin B are water soluble. Vitamin C used to acidify urine. That is also true. This is vitamin C molecule. So why it is acidic? Oxygen double bond is here. Here also double bond. So electrons are attracted to oxygen. Then because of the double bond, here electron density is high. So finally, these electrons from this oxygen has a tendency to attract towards here. So H plus is released easily. So it is acidic. So there is no COOH group, but it is acidic here because of the double bonds O. Vitamin C is an antioxidant, useful in collagen synthesis, amino acid synthesis, and all. Vitamin C deficiency causes scurvy. You get the swollen, bleeding, and gums. It is called scurvy. D, vitamin B12 is used alone to correct iron deficiency anemia. So if the deficiency is iron, why you want to give vitamin B12? That is false. This is vitamin B12 tablet. So molecular formula. Remember, it contains cobalt. Complex molecule. It contains cobalt. That is the important part. Vitamin B12 also called cyan cobalt amine. Vitamin B12 and folic acid also give similar neurological symptoms. Vitamin D is non-toxic in high doses. Vitamin D can be toxic, very toxic in high doses. These are fat-soluble vitamins, so it doesn't get easily removed from the body. It doesn't get easily removed from the body because it is not water-soluble. Water-soluble vitamins like vitamin B12 or other vitamin B, vitamin B1, B3, B6, all, they are easily eliminated from the body through the kidney because they are water soluble. True or false about drugs used in patients with bronchial asthma. Nebulized salbutamol is used to treat in the treatment of acute attacks. That is true. Salbutamol is a short-acting beta-2 adrenergic receptor agonist. It stimulates the receptor, causing bronchodilation, that is enlarging the airways. So it is true. Salbutamol causes bradycardia. Salbutamol causes tachycardia. Bradycardia is slowing the heart rate. Now, normal heart rate is around 72 to 100, take as normal. So, salbutamol causes faster heartbeat, that is more than 100 heartbeats per minute. That is called tachycardia. Bradycardia is less than the normal rate of the heartbeat. Prednisolone is used for the treatment of severe attacks. This is called about asthma. That is true. The dose 50 to 60 milligram per day. Then terbutaline belong to the theophylline group of drugs. That is false. Theophylline is a dimethylxanthine. I think the structure is given below. Theophylline is close to caffeine structure. So it is in like caffeine, same structure. This is theophylline and this is terbutaline. Terbutaline is a bronchodilator. Structure is different. So it is a different class of drug. It causes vasodilation, but it not the same group of drugs. Sodium chromoglycate is used for prevention. True. Sodium chromoglycate acts by inhibiting the release of chemical mediators from the sensitized mast cells. So I think you have to know about type 1 hypersensitivity. Mast cells are the monocytes in the blood, in the same cell. I will. What are mast cells? MAST cells. They are monocytes. Blood has neutrophil, leukocyte, eosinophil, basophils, and monocytes. So this is monocyte. So monocyte in the tissue, in tissues, it is called mast cell. So this is mast cell in tissues. Now, why mast cell should be blocked here with this drug? asthma is caused by allergies. So allergies, allergen maybe is anything with the protein content. So allergen may be pollen grains or dust or anything. So this is the mast cell. When a patient exposed to an allergen, some patients develop antibodies against it. So antibodies are proteins, it has body shape. These antibodies sit here. So these antibodies are in mast cell surface. So this is the first exposure to the allergen. To the allergen. So when the patient again, this here nothing happens to the patient. Second exposure, say after another 1 week, 2 weeks, or 1 month, even after 2 months, the mast cell is here. Antibodies are now attached to the mast cell here. The same mast cell. That is. Then the antigen in the second exposure, the antigen come and cross-link this week. Bind to this antigen, antibodies. So antibodies are here, the specific antigen, same antigen will come and cross-link here. So then what happens is this cell get burst and released many chemicals. They are heparin, leukotriene, histamine. So these are these are causing the anaphylactic shock or the. So these will the result is bronchoconstriction. Vasodilation. Bronchoconstriction is enlarged, the airways get constricted, become narrow, difficult to breathe. That is asthma. Vasodilation is blood vessels become suddenly enlarged. What happens? The blood pressure goes down very badly because when the blood vessels are immediately become enlarged. So brain doesn't get enough blood. So patient immediately collapse, and unless treated immediately with adrenaline, patient will lose the life. So this is called type 1 reaction, type 1 hypersensitive reaction. So the treatment is, immediate treatment is adrenaline. In hospitals, they keep the adrenaline. When they give penicillins and all, they cause this reaction. Okay. Now, so sodium chromoglycate, what happens here? It is explained here. It inhibits release of chemicals mediators. It inhibits this step. Even after cross-linking, when the chromoglycate is given, the mast cell will not burst. Mast cell will not burst and release chemicals. So nothing happened to the patient. So no asthma. So it is a prophylactic treatment because if the patient has asthma, this can't do anything because this already happened. Chemicals are released, nothing can be done with chromoglutamate. But this is given as a preventative treatment to prevent getting asthma. Number 4, true or false about treatment of tuberculosis. This is numbering from actually 26 of the 2001 paper. So, true or false about treatment of tuberculosis, a combination of 2 drugs is used. So that is false. For TB, at least 4 drugs should be used. At least 4 drugs. They sometimes give 5 drugs. So this is called first line treatment. Isoniazid, rifampicin, pyrazinamide, and either ethambutol or streptomycin. So this is the first line drugs given for tuberculosis. If these drugs fail, then second line drugs can be used. The second question also about TB treatment. Isoniazid is known to cause liver damage. That is true. It's very toxic. C, ethambutol should not be given to children under 5 years of age. That is true. What happens here is ethambutol cause vision problems. Especially they lose the color vision. That is color blindness. So when a child below 5 years is given this, and if the child get color blindness, he cannot explain it. He cannot explain about the color blindness. That is why they are not given this ethambutol tablet. Rifampicin produces red colored urine. Rifampicin itself is dark red. Color of the rifampicin is dark red. So when anybody takes rifampicin, urine turns red, but no need to give any treatment, because once the treatment is stopped, that color will go. That is not a problem. So you have to continue with the drug. Urine, not only urine, tears, and all body secretions, even saliva may get some pink color when you give rifampicin. Drugs are recommended to be completely stopped after 2 months treatment. That is false. They have to continue up to 9 months or 6 months. If the prognosis is very good, they can stop at 6 months. Otherwise, continue till 9 months. Treatment regimens include isoniazid. That is what I said. No, that's okay. Now see, true or false of diuretics. Furosemide is a loop diuretic. That is true. Furosemide is a loop diuretic. It acts on loop of Henle, preventing 25% of sodium reabsorption from the glomerular filtrate. That is true. Loop of Henle is that bottom of the U part of the glomerulus. So thiazides should be avoided in diabetes. What happens is thiazide drugs are interfering with carbohydrate metabolism. So the patients can develop diabetes on long-term treatment. So if a patient has diabetic, they are not given thiazide drugs. Spironolactone is a potassium losing diuretic. Spironolactone, not potassium losing, it is potassium sparing diuretic. It retains potassium. In the distal tubule of the kidney, glomerulus, distal tubule, what happens is from the urine filtrate, potassium is eliminated. Normally, so when urine is filtered, this filtration, this is loop of Henle. So the reabsorption occurs continuously. Here sodium reabsorption. Here also sodium reabsorption occurs. In this part, potassium ions from this filtrate enters the blood, and from the blood vessel, and from the blood vessel, from the blood vessel, potassium K plus ions enter the filtrate, and from the filtrate, sodium ions come to the blood exchange. So potassium ions are given to the filtrated to pass urine, and sodium ions are taken back to the blood. But because the normal range of potassium ions in blood is K plus in plasma 3.5 to 5.1 millimoles per liter. Now, this has to be maintained, very narrow range. So, this mechanism controls it within this limit. This mechanism controls the blood potassium within this level. Now, if you think about sodium, normal range is sodium. This is millimoles per liter. Sodium 135 to 146 millimoles per. So sodium will need this section. Potassium, to maintain the blood potassium levels, you need this exchange. Now, if a patient is taking, say, furosemide will block this sodium reabsorption, and also some potassium reabsorption is also there. So then when the patient gets furosemide as a diuretic, they lose potassium also, calcium also lost. So to compensate that, this exchange is blocked. Now, when this space is blocked by spironolactone, so the potassium in the blood will be retained. This exchange is not there. So potassium, that is why it is called potassium sparing drug. Okay. Spironolactone is a potassium losing diuretic, that is false. D. Loop diuretics are known to increase serum potassium levels. Loop diuretics are known to increase serum potassium levels. That is false. As I said here, loop diuretics like furosemide will lose potassium from blood. 6. True or false about beta blockers. This 6 is question number 31. True or false about beta blockers? They are used for prevention of angina. That is true. Beta blockers has many uses, 8 uses. One is arrhythmia, heart failure, then coronary heart disease. After heart attack, they are given angina, they are given for hypertension, they are given for migraine, and they are given for thyrotoxicosis. When the T4 levels is high, thyroxine levels are high. When it is finally it goes to thyrotoxicosis, the patient gets tremors. So to reduce that, they give this beta blockers. So the uses of beta blockers are many, not only for hypertension. Timolol belong to this group. Timolol is, yeah, that is true, but normally used as eye drops. Very short acting, but used as for hypertension, not routinely used. They are contraindicated in patients with bronchial asthma. That is true, because all beta blockers have some effect on, there are selective and non-selective beta blockers. Selective beta blockers means they will affect only on one type of beta receptor. Beta receptors are 2 types. One is beta 1, beta blockers. One is beta 1 receptors are in beta receptors. Beta 1 is in heart. Beta 1 here, beta 2 mainly in lungs. Bronchial airways. Beta 2 receptors, when stimulated, cause dilation. So airways are easily open. Easy to be hard, stimulated. Beta 1 increased heart rate. Increased heart rate. So what happens when now we are using beta blockers? What happens when blocked? Blocked. It is blocked. It is constriction. Becomes narrow when you, it is, say, this is a normal size of the airway. When it is stimulated, it gets bigger. In the lungs, when it is blocked, when the beta 2 receptors are blocked, it becomes smaller, constriction. So difficult to breathe. Beta 1 receptors stimulated increase heart rate and also increase blood pressure. Reduced block, decrease blood pressure. So we are giving a beta blocker to decrease blood pressure, but if it is non-selective like propranolol, it will give more constriction, but most of the selective beta blockers are now do this one here, only effect on heart, but there is little effect on lungs also. So when the heart blood pressure goes down, this also happens. This happens. See? Constriction of the airways. So normally, a normal person can stand this, but if the patient is asthmatic, they normally don't give beta blockers. Okay. The atenolol is suitable for once daily use when treating hypertension too, because atenolol is a long-acting drug. So once a day is enough. Sometimes they give twice a day, most of the time once a day dose is enough. They are known to cause slowing of heart rate. Beta blockers slow the heart rate. That is what I'm saying here. It slows the heart rate. Seven, true or false regarding penicillins. Phenoxymethyl penicillin is administers on an empty stomach to minimize the bad gastric irritation. Now, it is true that oral penicillin or phenoxymethyl penicillin is oral penicillin. These tablets are given asking the patient to take it at least 1 to 2 hours before meals. Because not because of gastric irritation, it in acid medium, better absorption. That is the only reason. Better absorption when it given in the acid medium, that is empty stomach. B, benzathine penicillin is given every 21 to 26 days to prevent rheumatic fever. It is not given after 21 days. It is given every 28 days. Benzathine penicillin is given every 28 days. It doesn't. It is not given as a treatment. It is given as only as prophylaxis, just to prevent the prevent getting the streptococcus infection that cause rheumatic arthritis. If the patient get frequent streptococcus infections. Erythromycin is contraindicated in patients who are hypersensitive to penicillins. Patients are hypersensitive to penicillins. That is what I explained. Hypersensitivity reaction type 1. You get anaphylactic shock with penicillin, or sometimes rash, anything, allergy, so anaphylactic shock. But erythromycin is not like that. You can give erythromycin when for patients who are allergic to penicillin. Erythromycin is not contraindicated. It's a safe drug. Fluoxetine is indicated for staphylococcal infections. That is true because fluoxetine is resistant to penicillinase, beta-lactamase. Penicillinase and beta-lactamase are the same. So, staphylococcal penicillin, beta-lactamase producing. So, producing bacteria So Staphylococcus normally produce beta lactamase. So cloxacillin is given because cloxacillin can resist beta lactamase action. So again, if you ask why and how it happens, penicillin molecule has a beta lactam ring like this branch here, another branch here. So this beta lactam ring is attacked by penicillinase, this part. Penicillinase or beta lactamase, you can see beta lactamase. Beta lactamase inside. Beta lactamase is produced by bacteria. In amoxicillin, cloxacillin, what happens is they have introduced branches, different branches in structure up to here. So now in cloxacillin, penicillin cannot reach this part of the molecule, penicillin molecule, because the branch going here is covers here. That is called steric hindrance. Steric hindrance. So cloxacillin covers this part. So beta lactamase cannot reach the beta lactam ring to attack it. Amoxicillin is better absorbed from the bowel than ampicillin. That is true. That is one advantage of amoxicillin. It does not interfere. Food does not interfere with amoxicillin absorption, but interfere with ampicillin absorption. Number 8, true or false? Ciprofloxacin is not recommended in children under 12 years of age. True, because cipro cartilage, it affects cartilage,